afternoon, good evening, everyone. Hope all of you are doing great. I'm Dr. Abdul Qadir, emergency medicine specialist. I'm here with you with another episode of Ultrasound Physics from Mastery Academy. Today, we want to talk about one of the most fundamental and actually I can say the misunderstood parts of ultrasounds. It's about pulsed waves. So let's start with one question. As emergency medicine residents or someone else that you are already started to use ultrasound in your practice, maybe sometimes you think about how does an ultrasound machine turn invisible sound waves into a clear image on your screens. It is not just magic. It is all about pulsed ultrasound. That's why today we want to talk about pulsed ultrasound. In diagnostic imaging, we don't use continuous sounds. You know why? Because continuous waves never pause to listen. They cannot create an images. They are great for some measuring like blood velocity, but they tell you nothing about anatomy. Imaging requires precision, so we need to have some short bursts of sounds that we call them pulses. So we will send them inside the body, these short bursts of sounds, and then we need to listen, to pause and listen for the echoes that bounce back from the tissue. This sending and listening pattern is how we build real-time images of the heart, lung, fetus, or everything else that you are scanning for. So in this chapter, what we want to learn, we wanted to know what exactly a pulse is, how it built, and actually how the 5 key parameters that we will discuss about all of them later, like pulse duration, repetition frequency, directly affect image quality, resolution, and scanning depth. So by the end of this session, we wanted to learn about ultrasound physics, and actually we wanted to learn how to apply them at our bedside ultrasonography. Okay, so now that we introduced pulse ultrasound, let's answer a basic but very important question. What exactly is a pulse? In ultrasound is not just one wave. It is a group of waves, usually 2 to 4 cycles that travel together. You can think of it like a train. Each cycle is a car, but they are all connected and move together as a single unit. The pulse has a clear start and the end, and it is it is not ongoing like a continuous wave. It is what allows us to send sounds and then stop and then listen for returning echoes. This is very critical, because so in the on time, the machine is transmitting sounds, so we call them transmit time. And in the off time, that which the machine is silent, so we are waiting for the echoes returning back. That's receive time. This alternating talking and listening rhythm lets us pinpoint where structure are and build a slice by slice image of the body. So remember, pulse is not just sound, it is the building block of every image that you see on your screen. Okay, now that we know what a pulse is, we talk that it is a short burst of sound with a clear start and end. So let's look at how to describe it. There are 5 key parameters that tell us everything that we need to know about a pulse in ultrasounds. These form the foundation of how ultrasound images are shaped, how deep we can scan, and how sharp the image is. So let's break them down. The first one is pulse duration. So pulse duration means how long the pulse lasts, measured in time, like microseconds. So pulse duration is how long the pulse lasts. The measurement is per the time. So it is micro sounds. The second one is spatial pulse lengths. How long the pulse is in space, imaging the physical length of the train. So not how long it takes to pass, but how many meters it spans. So the pulse duration, it was the time, and the spatial pulse length, it is the measurement, physical measurement. It is about the like distance, how long it takes to pass in the space. So the third one is pulse repetition period. This is a total time from start of one pulse to the start of the next one. It includes both the pulse itself and the listening time. So pulse repetition period is something like the pulse duration, but the difference is the difference is the next one, pulse repetition frequency, means how many pulses we send every second. Think of it like the machine's heartbeats. So the pulse repetition frequency is the heartbeat of the ultrasound machine. And the last one is duty factor, the percentage of time the system is actively sending sounds versus listening. So we don't have to memorize all of these at once. We will go through each one step by step. We will explain them. So don't worry, you don't need to memorize all of them right now. We just want to introduce them. So we will talk all of them one by one, and I will show you how they connect to what we actually see in the screen. Okay, so let's start with one of the most important key parameters, pulse duration, or in short we can say PD. It simply answers this question: how long does each pulse last? So the pulse duration is about how long does each pulse last. So we are talking about the time here from the beginning of the first wave in the pulse to the end of the pulse, to the end of the wave of the end of the last wave of the pulse. So start from the first wave of the pulse to the end of the last wave of a pulse. It is pulse duration. The formula is very, very straightforward and important to memorize it. Pulse duration, the number of cycles in a pulse, for example here 1, 2, 3 or 4, and by the period of each cycle, how long takes to pass. So it is pulse duration, so the number of cycles in the pulse by period of each cycle. So if you have more cycle or each cycle takes longer, the pulse duration increases. In diagnostic imaging, most pulses last between 0.2 to 0.3 to 2 microseconds. That's millionth of a second. So what is the normal pulse duration? 0.3 to 2 microseconds. And here is something very important that we need to think about it. We need to memorize it. It is about we cannot change pulse duration manually, and it is says by transducer and the design of ultrasound system. So the sonographer is not able to change the pulse duration during examination. So why does this matter? Shorter pulse give us sharper resolution, so we discussed it before, and they help us better separate reflection from structure they are close together. So the shorter the pulse duration, the more precise the image that we can have in our ultrasound study. Okay, so let's take a closer look at what actually make a pulse longer or shorter. So remember about the formula that we discussed last slides. From the last slides, it was pulse duration, means the number of cycle by period. So we can make the pulse longer in two ways, either by increasing the cycles, the number of the cycles, or increase the period. I mean, each cycle lasts longer, make each cycle last longer. So either way, that means a longer pulse duration. But in diagnostic imaging, we don't have a longer pulse duration. We want something else. We want to pulses to be as short as possible, because shorter pulses give us sharper resolution. They reduce overlap between retaining echoes from closely spaced structure. As you see here, the pulse duration is it is long, so we cannot distinguish closely spaced structure here. So there is two different objects close together, but we detect them as one object. So we are using a long pulse duration. But if you're using short pulse duration, you can detect every object very clearly. Even the closely spaced structures, we can see them and we can, detect them separately. So it is about the short pulse duration that you discussed. So we like to have a shorter pulse because give us sharper resolution. So let's talk about the most important clinical takeaway from this part. If you see a transducer producing 2 to 4 cycle per pulse, it's very low. It is all on purpose. That's the sweet spot of high image clarity. So we are using lower pulse duration because we wanted to have it. And we said earlier, the pulse duration is not adjustable. The sonographer cannot change it. It is determined by the machine and the probe that you are using. So, while you cannot change the pulse duration directly, but understanding it helps you to choose the right probe for your job. So, you will choose a probe that gives you shorter pulse duration to have a clear and an image with more resolution. Okay, let's shift from time, pulse duration, to space, SPL, spatial pulse length. SPL specifically is about how long a pulse is in physical distance. If pulse duration is like asking how long does the train take to pass, the SPL is about how long is the train itself. So SPL is the physical length from the front of one pulse to the back. It tells us how much space the pulse occupies as it moves through the body. So here is the formula for SPL, the number of the cycle by wavelength. So more the number of cycle that you have, or longer the wavelengths, means the longer the SPL. Remember, the wavelengths depends on both transducer and the medium that sound travels through. So that's why SPL also is influenced by both, because the SPL is the number of cycle by the wavelength. So if the wavelength depends on both transducer and the medium, for sure the SPL also influenced by both transducer and the medium that sound travels through. In clinical imaging, SPL is measured in millimeters, and just like pulse duration, it is the thing that you should know. You cannot change SPL manually. So we cannot change the pulse duration, we cannot change also SPL manually. So why this is important for us? Because we need to know, just like short pulse duration that improves temporal resolution, here shorter SPL improve axial or depth-wise resolution. So we'll talk about the temporal and axial resolution later. Just keep in your mind the pulse duration. Short pulse duration improves temporal resolution, and the SPL improve axial resolution, helping us distinguish structure that lie close together along the beam's path. Okay, so now that we covered all about pulse duration and spatial pulse length, SPL, let's compare them head to head. I think differences are crystal clear, are very obvious. Both are based on the number of the cycle in the pulse. So we discussed about the formula. As you see here, the pulse duration is the number of cycles by period, and here SPL is about the number of cycles by wavelength. So both of them depends on the number of cycle. But the pulse duration is talking about the time. How long does the pulse last in time? And we measure in microseconds, and the SPL is talking about the distance. How long is the pulse in space? So we measure in millimeters. This affects how well the machine can separate echoes coming from the closely spaced structure. We can just picture the pulse duration and SPL like that. So just imagine that you are standing in a railroad crossing. The time that it takes the train to pass is pulse duration, and the actual length of the train is SPL. Both impact image resolution that we discussed it before, but in a different waves. The pulse duration impact on temporal resolution, how fast we scan is about the temporal resolution, and SPL impact on axial resolution, how sharp the image is in depth. We will talk about temporal and axial resolution later. We just, as we discussed it, we need to remember to keep in our mind that the pulse duration increase the temporal resolution if it is short, and SPL increase the axial resolution if it is short. And just like the train size, it said when it leaves the station, both of them, I mean the pulse duration and SPL, are not adjustable by the sonographer. They are built into the system, I mean the ultrasound system, the transducer, and we cannot change them. So we discussed about PD and SPL. Right now I want to talk about another pulse parameter that it is adjustable. It's about pulse repetition period. The pulse repetition period means how often we fire. The definition is time from start of one pulse to start of the next one. So what was different between pulse duration and pulse repetition, the period? If you remember, the pulse duration, it was about, so let's have a one pulse here. It's not a good pulse, but it's okay just for learning. So for the pulse duration, we talked about it. So it was the first wave of the pulse at the end of the last wave of that pulse. It is pulse duration. So pulse duration is transmit time, but pulse repetition period, it includes the listening time also. So means the first wave of the pulse to the first wave of the next pulse. So I mean the beginning of one pulse to the beginning of the next pulse. It's all pulse repetition period. So pulse repetition periods includes transmit time and listening time. We measure both of them in milliseconds, but the pulse repetition period is adjustable. How? Controlled by depth setting. If the depth is high, means the pulse duration is high, but if the depth is low, means the pulse repetition period is low. But how? Just picture here, it is your transducer, and you want to scanning two objects, one of them in these depths and another one in these depths. So here you are sending your pulses, and here we have returning echoes. So in a short time we have returning echoes, so means the listening time is shorter. That's why the pulse repetition period is shorter. But here, if you are scanning this object in these depths, so we need more time to have returning echoes. So the listening time is longer. That's why pulse repetition period is longer here. Okay, so right now we know how much time passes between pulses that we called PRP. Let's flip the perspective and ask how many pulses, do we send per second? It's called pulse repetition frequency. So pulse repetition frequency means the number of pulses that you can send per second, measured in hertz, and typically range between 1,000 to 10,000. So the measurement, the unit is hertz, pulse per seconds. What is the relationship between the PRF and the PRP? They are in flip side of each other, means reciprocal relationship. If you multiply PRF by PRP, always the result is 1. The good news also here is PRF is adjustable as the PRP was by changing the depths. So let's see how we can change the PRF and PRP again. So if you are going for a deep structure, like for example you are scanning abdominal ultrasound, for example for the liver, so the depth is for example here, so means the listening time is too long, so means pulse repetition period, pulse repetition PRP period is high. But what happened to the pulse frequency, pulse repetition frequency? So as the listening time here is very long, so we cannot send many pulses per second. So means pulse repetition frequency is low. We can send less pulses per second. But if you are scanning a shallow structure like a skin, so the listening time is very short, means so the depth is low, so means the pulse repetition period is low, listening time is low, so means we can send many pulses per second, so means PRF is high. So that's why, so when you're scanning in depth, means the pulse repetition period is high, the pulse repetition frequency is low. And also if you are scanning a shallow depth, means the pulse repetition period is low, but the pulse repetition frequency is high, as you can send many pulses per second. Okay, so we talk about how long a pulse lasts, how far it travels, and how often pulses are fired. Let's talk about something else, duty factor, DF. What is about? It's about what percentage of time is the ultrasound system actually transmitting sounds. It is the duty factor. It's calculated using very simple formula, the pulse duration divided pulse repetition period multiplied by 100%. So what was the pulse duration? It was transmitting time. And what was the pulse repetition period? It is the combination of pulse duration plus listening time. So if you have more listening time, so means the duty factor is low. So in diagnostic imaging, most of time system is listening, not talking. So the machine is listening machine, is not like a talking machine. Because in listening time, we will get more information from the structure that we are scanning for. So we have more information and we have better images. So that's why the ultrasound machine is a good listener. The duty factor is usually reports between 0.2 to 0.5% is very low. Let's compare continuous wave Doppler and B mode. How the continuous wave Doppler is not good for ultrasound imaging. In continuous wave Doppler, it is continuous wave. So means there is no pause between the pulses. So means the pulse duration is exactly same as pulse repetition period, because there is no listening time. So the duty factor is 100%. So if you don't listen to anyone, you cannot understand them. So that's why continuous wave Doppler is not good for ultrasound imaging. So maybe it's good for some measurement, some like velocity, blood velocity measurement, but it's not good for imaging at all, because there is no anatomical information with continuous wave Doppler. But in a B mode imaging, so there is a pause between the pulses. So we send a pulse and then pause and then listen. And this pause is longer than transmitting time. That's why the duty factor is low, and we are listening more. We are getting more information from the anatomical structure, so we have better images. So the B mode is the best mode for imaging, for ultrasound imaging. As depth increase, what's happened? The PRP increases. So if the depth increases, the PRP increases. So what's happened? The pulse duration stays the same. Means the transmitting time still is the same, but the listening time is more. What does mean? So means we need more time for retaining back the information from the structure that you are scanning for. So the pulse duration is the same, but PRP increased. So means the duty factor decreases. So we reviewed all the 5 pulse parameters, but what really matters for you as a sonographer or clinician that you are using ultrasound at your bedside? Which one can you actually control? Here is the review. The pulse duration and the SPL, we cannot control them. So they are fixed by transducer and the medium and the speed sounds. So we cannot change the pulse duration and SPL. But PRP and the PRF, you can control them indirectly by adjusting imaging depths. Shallow depth means short PRP and high PRF, and deep depth means long PRP and low PRFs. And the duty factor also is indirectly controlled since it depends on the ratio between the pulse duration and the PRP. As depths increase, the PRP increase and duty factor goes down. While you cannot change the pulse itself, but you can control how often it fired and change how your system behaves, like speed, resolution, frame rate, and that's why depth is more than just a zoom level. It shapes how your machine works under your hand. Okay, so let's take everything we learned and see what actually happens when you adjust the depth on your ultrasound machine. Depth doesn't just like changing how far you look. It reshapes how your system fires pulses. Let's take it about more. Picture you're imaging a shallow structure. You don't have to wait long for echoes to return, so the system can send more pulses per second, means higher PRF, and the time between the pulses is short, means short PRP. That means the system is spending higher percent of the time on transmitting, so means higher duty factor. So you will get higher frame rate, better temporal resolution, and faster image updates. But if you are scanning in depth, means echoes take longer to return, the system wait longer between the pulses, means long PRP. Fewer pulse can be sent per second, means low PRF, and the system spends more time on the listening because they are far from us and takes time to get to reach us. So means spending more time on listening, and it means lower duty factor. This is fine for scanning something like aorta, the pelvic organs, or something else in depth. But your frame rate is drops and motion may appear slower. So the deeper you scan, the less frequency your machine fire pulses and more time it spends waiting. But if you are struggling with poor frame rate, check your depth just. Something like, just going slightly shallower gives you much faster and clear images. So if your frame rate is low, your image is not clear, sometimes you just need to decrease the depth to have better imaging, faster and clear imaging. So here let's take a look at a real useful visual example for this topic. This diagram shows 4 different pulses pattern labeled A through the D, A, B, C, and each one reflect a different clinical scenarios based on duty factor, how much of the time the machine is actively transmitting sounds. The pattern A is continuous wave, so there is no pulse and gap between the pulses. The system is constantly transmitting. This is continuous wave Doppler and not used for imaging, just we are using it for some measurement like velocity. So duty factor here is 100%. But in pattern B, what's happened? There is a big pause between the pulses. So there is a short transmitting pulses but long waiting time between them. There's a clear classic of a deep scanning behavior. The duty factor is low, so maybe it's about 0.2%, and it is something about scanning some organs in depth. But pattern C, what's happened? There is no pulse, just silent, no pulse at all. So maybe the probe is disconnected or it is not on. The duty factor is 0%. But regarding the pattern D, so what's happened? There is a transmitting, but there is a short time between them. So less waiting in between. The system is working very fast. There is multiple pulses in 1 second. So this machine looks like scanning a shallow object. So the duty factor here is high, maybe around, for example, 0.5%.
the key learning here is that the duty factor directly reflects how deep you are scanning. More listening, lower duty factor. By reading this pattern, so right now we learned and we can see how the machine behaves just by looking at the timing. So if you are scanning in depth, so means you need more time between the pulses just to analyze the information that you are getting back from the anatomical structure that you are scanning for. But if it is your scanning is shallow structure, so the pulse is less, shorter, listening, so means you are sending more pulses. So means here the duty factor is higher. But if you are scanning in depth, the duty factor is lower because you cannot send more pulses. You are spending more time on the listening, not on sending pulses. And here, just for understanding the pulse anatomy, so we want to discuss them again with some diagram. So the line A, if you see here, it started from the beginning of one pulse and to the end of the last wave of that pulse. So it is pulse duration, is a transmitting time. So the axis is time and the pulse duration. If the axis is distance in the same diagram, so the distance, the measurement will be SPL. So it shows the size of the pulse either in time or space. The line B, shows the height of the wave from the baseline to the peak. So this amplitude that we discussed in previous sessions. Amplitude related to the strength and intensity of the sound wave. It has nothing to do with timing, just how strong the pulse is. And the C, this is pulse repetition period. So if you see here, started from the beginning of a pulse to the beginning of another pulse. So it includes both transmitting and listening time. The longer the pulse repetition period, the slower the machine is firing pulses, like in deep imaging. And the D, if you see here, there is a single cycle. There is a single cycle of sound wave. It measures in time, and it is period. It measures in distance. So if it is measuring distance, it is the wavelength. So again, it depends on the axis of the units. So for the D, we're just showing a single cycle. So it could be period or wavelengths, depends on what we are measuring for. So if you are measuring the time, is the period. If what you're measuring is in distance, so it is wavelengths. And the E, if you see here, there is a gap presence between the pulses. So it is listening time. So silent interval after a pulse. It is part of the PRP, as we discussed it before, but not part of the pulse itself. The longer this gap, the deeper your system is scanning. Understanding these labels helps you diagnose image quality issues, frame rate, lag, and improper depth setting, just by visualizing how your machine is behaving. So we discussed it here about the pulse duration and its SPL, amplitude, and PRP, PRF, period, and the wavelengths of one wave. And also we're talking about the listening and off time when the machine is listening to have and analyze the written echoes. So let's move from solid physics knowledge to practical knowledge. So what really happens when you increase your scanning depths? Every time that you increase the depths on your machine, it affects how pulse behaves, and it all goes back to the physics that we just learned. First, your machine needs more time to wait for echoes to return from the deeper tissue, so it increases the pulse repetition period. It waits longer between the pulses. This lowers the pulse repetition frequency, fewer pulses per second anatomy, and also drops the duty factor. The percentage of time your machine is transmitting gets even smaller. The result, your frame rate drops, image update more slowly, This is perfectly normal and something like necessary when you are scanning deep structures, like pelvic structure, or doing transabdominal vascular study. So what we can do, use lower frequency probe. It penetrates deeper with less attenuation. Reduce your depths as much as possible. You go as deep as you need, and narrow your sector width to improve frame rate in focus areas. We will discuss all about them later, so just for having some like knowledge about them, so we are discussing here about the sector width, frame rate, that we will discuss them in the next session. So depth is not just about how far you see, it completely reshapes how your system fires pulses and builds images for us. So now let's bring everything together. Ultrasound imaging depends entirely on the ideas of pulses, short, controlled bursts of sound energy. So the pulses is short, controlled bursts of sound energy. And we learned there are 5 key parameters that describe how those pulses behave. Pulse duration, it was about how long the pulse is on. So regarding the time, how long the pulse is on, and SPL, how long the pulse is in the space, like distance, and pulse repetition period, how long the system waits before the next pulse, and the pulse repetition frequency, how many pulses we send per second. The duty factor that we discussed about at how busy the system is, like percentage of time transmitting. So we learned pulse duration and SPL are fixed, set by the transducer and the physics of the sound. But PRP, PRF, and duty factor are adjustable. They change when you adjust the depths. Here's the clinical payoff that we need to review and learn. Want better resolution, so use shorter pulses. Want smoother images, work at the shallower depths to allow more frequent pulses. And going depth, machine is slowing down on purpose. It's just about giving echoes time to retain, to analyze. We have more time to analyze, to retaining echo, to analyze the information that you are getting back from the structure that you are scanning for. The more you understand these 5 pulse parameters, the better your images, and actually we can say your clinical decision will be better. Just for review what we learned, please pause and let's discuss this question. Please comment your answer here for us. The first one is, what was the formula for duty factor? The second one, which 2 pulse parameters are not user adjustable? Just name parameters that you cannot adjust them. And what happened to PRF when imaging depths increase? And also we can discuss about what happened to the PRP, what's happened to the duty factor. So just please comment for us. And the last one, why are short pulse duration and short SPL preferred in imaging? What is the rule of shorter pulse duration and SPL? And what happens if you have a longer pulse duration and SPL? So please comment your answer here. We will discuss them. So here is just like a simple diagram to see the relationship between the depths, PRP and PRF and duty factor. So we discussed all of them. So the deeper you go, the longer you wait, and the less you transmit. So it's all about understanding between the depths, the PRP, PRF, and duty factor, and for sure our image clarity, and the sharpness and resolution. So understanding the depths is very important, that every sonographer, every clinician should be aware of it and use it in the right and proper depths to have a better imaging and for sure better clinical decision. So as a clinician, as an emergency physician or some clinician, if you are scanning a shallow structure like thyroid, nerve, for black like that, so you need faster PRF, higher duty factor, so better temporal resolution. But if you are scanning in depth like a pelvis, like OB scans, so you need slower PRF, means lower duty factor and better penetration, but we lose our frame rate. So clinical pills helps links physics to improve our image quality in our real life use. So here again, just let's review the formula that we have for pulse duration, pulse SPL, PRP, PRF, and DOT factor. We discussed all of them before. Just here we have all of them for reviewing them again. So what are their units, and they are adjustable or not. At the end of this session, I want to say thank you for everyone for being fully engaged in this session. Thank you very much for your time. We learned about what the pulse is, what are the 5 key pulse parameters, and how we can control our machine with the depths, and how depth shapes everything: PRF, PRP, duty factor, and ultimately your images. So we need to, the next time that you are scanning a machine, just please think how just pressing a button change your image resolution, your image clarity, and how you can have the better images and better clinical decision just with pressing some buttons, because right now you understand how things change with these simple changing. For example, with just one changing the depths, how your image is better and how you can see them and how you can trust more on the resolution, on the distances, on your measurements. Thank you again for everyone for being with us today in this session. So please follow us and share this episode with your friends, with anyone that have interest in ultrasound imaging, like clinician, like sonographer, or maybe you are preparing for any ultrasound exam. So please share with them and subscribe to our channel. So we will be with you in the next episode and discussing more about ultrasound physics and how we can bring ultrasound physics in our clinical practice. Thank you very much. Have a good day.